Okay, welcome to the Scoop, NANP's monthly Hot Topics educational webinar series. I'm Shannon, and we are having a little bit of technical difficulty. If somebody could let me know in the comments or the questions window, if you can hear us, that would be really helpful. I just want to get a quick test and see if you can hear me. Okay. I'm not getting any response here. Okay, I'm going to go ahead and welcome Dr. Tom O'Brien to the Scoop webinar today. Dr. Tom O'Brien is a world-renowned expert in the field of gluten-related disorders, non-celiac gluten sensitivity, celiac disease, and their link to other chronic health conditions, including autoimmune disorders and diseases as they occur inside and outside of the intestines, and the development of autoimmune conditions for his certified gluten practitioner course, which revolutionizes the way healthcare professionals work with those suffering from gluten-related disorders. Dr. O'Brien founded and hosted the world's first gluten summit, where he interviewed 29 experts and opinion leaders on the topic of gluten-related health issues. He is also the founder of thedoctor.com, which was created to educate the public about underdiagnosed and undertreated gluten-related disorders, which affect up to 30% of the population. He views the lack of recognition, diagnosis, and treatment of these disorders as a public health crisis. So please welcome Dr. Tom O'Brien. Thank you for joining us today, Doctor.
Oh, thank you, Shannon, and hello, everyone. As Shannon mentioned earlier, there seems to be some technical difficulties. If you can hear this, if you're hearing this presentation, can you type a comment into the comment section, which our monitors will be able to see, and they can verify that we're actually transmitting. So I'm going to assume that we're transmitting for the moment until we can get some verification of that. So let's get started. It's my understanding that our attendees today will be both nutritionists from the National Association of Nutrition Professionals and the general public. So I thought the best thing I could do for you in talking about our book, The Autoimmune Fix, is to give you some of the highlights from the presentation that I gave at the NANP conference, which occurred just a short time ago. So I'm going to talk about some things that may be a little bit technical, and if you have questions on that, just type those questions into the question column and we'll get to them during the Q&A period. And Shannon, do we have validation that this is being heard? Are you receiving?
Yeah. Yes, Andrea, let me know that you are being heard.
Okay, good. In my question and answer box, the question box, there's no entry. So if we have to do this again, I'm happy to do it again. But if you're confident that we're rolling, we'll do it now.
Yep, Andrea seems to be pretty confident that we are live and being heard.
Okay, good.
Thank you, Andrea.
Then while I'm doing this, perhaps, Shannon, you can look and see why there are no comments in the comments section. Is there something with the system that's not recording them for the Q&A, which will be in about 40 minutes? And,
yes, I will look into that. Thank
great,
you.
Thank you. So in the world of autoimmunity, I have to acknowledge that, oh my goodness, what's happening in my system here? I cannot change a slide. Why can't I? Oh, there we go. Okay. But autoimmunity, we have known for a long time, is a trilogy. There's a trilogy in the development of autoimmune diseases. We've known there was always the genetics. Well, that's your gene. You got MS because you carry the genes. And we've known that the environment has something to do with it. And in the last 15 years, we know that the environment actually turns your genes on or turns your genes off. That's been now commonly accepted. And theories on that have been around for 30 or 40 years. But now we know that it's not that the genes themselves are causing your problem. It's that the environment you're exposed to is triggering the genes that cause the problem. And your environment includes anything outside your body. And the most common environmental trigger is the food that you eat. What's on the end of your fork is a critical contributing component to the diseases that we get. And in this discussion, it's that foods are a primary trigger to the genetic vulnerabilities you have to develop a disease. So if you have the genes for Alzheimer's, for example, Dr. Dale Bredesen at UCLA has published papers on completely reversing Alzheimer's on 9 out of 10 people. And he published that in 2014, and now he's got over 100 people completely reversing Alzheimer's. And there is an autoimmune component to Alzheimer's. And so the thing we know about Alzheimer's is that having the gene just makes you more vulnerable to getting it. And what we have to do is turn that gene off. And the way you turn the gene off is by stop being exposed to that environmental trigger. So what's at the top of his list of the 37 points on the checklist? At the very top of the list is a gluten sensitivity or a dairy sensitivity, or are they eating too much sugar, so their insulin resistance is bad. That those are at the very top of the list of the environmental triggers that turn the genes on to produce Alzheimer's. So we're going to go into a little bit of this mechanism today. And the study started coming out over 10 years ago, as you see on your screen, that yes, there's genetics, and yes, there's the environmental triggers, exposure to these environmental things, including foods. But now we know there's a third component, and that is the loss of your intestinal barrier, meaning, Mrs. Patient, your intestines are a tube. It goes from the mouth to the other end. It's 20, 25 feet long. It winds around inside your abdomen. If you were to take a donut and stretch a donut out and look down the center of that donut, it's one big long tube. And when you swallow food going into your intestines, it's inside the tube. It's not really in the body yet. It's got to get through the walls of the tube to get into the bloodstream. And that the barrier inside the tube is what we refer to in terms of intestinal barrier function. Because the inside of that barrier, the inside of the tube, is lined with cheesecloth. And just like your grandmother's gravy, you pour the gravy in and the liquid comes out the other side and the big clumps stay on, can't get through. That's what happens inside your intestines, is that your food has to be digested and getting smaller and smaller and smaller until they're small enough to fit, the pieces are small enough to fit right through the cheesecloth. But when you lose that cheesecloth restrictive barrier, when you get tears in the cheesecloth, now clumps of food get through into the bloodstream before they've been broken down by the enzymes and are small enough to get through the cheesecloth. Now you've torn the cheesecloth, and that's called loss of intestinal barrier function, or the slang term is leaky gut. And that is a critical paradigm to understand in the development of autoimmune diseases. So when we look at autoimmune diseases, I'm having a hard time changing my slides here. I've never had that happen before, but my slides are not changing. Let me try different buttons. Nope, it's not happening. My system is froze now. I don't really understand what's happening with the slide. There we go. There we go. So it just changed now on its own. Okay. So I guess my computer's going to tell me when it's time to move on to the next subject. Permeability, and look at what the scientists say. It is, the underlining is mine, it is an early biological change that precedes the development of autoimmune diseases. And the autoimmune process, this is the take-home slide for all of this, actually, and for the book, is that the autoimmune process can be arrested. It can be stopped in its tracks if the interplay between genes and environmental triggers is prevented by reestablishing the cheesecloth, healing the tears in the cheesecloth, healing the leaky gut. So without the tears of the cheesecloth and these big molecules getting into the bloodstream, what the scientists are telling us is that you can arrest the development of autoimmune disease when you don't get these big molecules called macromolecules going into the bloodstream. So I'm going to talk for a moment or two about what is autoimmunity. And we know that Dr. Jeff Bland, one of the godfather of functional medicine, tells us that over 24 million people in the United States are diagnosed with autoimmune diseases. And this comes from the National Institutes of Health. And 1 out of 3 of these people are diagnosed, only 1 out of 3. And that's the 24 million. That means there's 72 million people out there with a diagnosable autoimmune disease, but it's not looked for until we're really sick. Now, that's really important, and you're going to understand why, because by the time you're diagnosed, you've had the problem going on for a long time. And autoimmune diseases, we've known for over 10 years. They're the 3rd leading cause of getting sick and dying in the industrialized world, behind cancer and heart disease. I'm talking about how prevalent this thing is. And when you start seeing the numbers, this is what it's like. It's like, oh my gosh, are you kidding me? I had no idea about this. And I'm going to show you just how frequent this thing is. We think that cardiovascular disease is the #1 cause of getting sick and dying in the world today. But when you look at the literature, we know that cardiovascular disease is an immune-driven inflammation process. That when your pipes plug up, it's the immune system causing the inflammation that plugs up your pipes. Atherosclerosis is considered an immune-mediated process of the blood vessels, of the vascular system. And look at this study that says autoimmunity plays a major role in the development of your fats being out of balance, cholesterol being out of balance, and the formation of plaque in your body. In your blood vessels. It plays a major role. The hardening of your arteries has been proposed to be considered an autoimmune disease. So when we look at the scientists saying this, and we see these kinds of drawings in the medical textbooks and in the research papers that show that the antibodies are primary in causing the hardening of the arteries, the plaque that forms, we know that if cardiovascular disease has an initiating autoimmune component, the question is, what becomes likely the #1 mechanism in getting sick and dying in the world today? It's your immune system trying to protect you. It's the immune system trying to for some reason, it's attacking your blood vessels. So what we talk about, what I talked about at NANP and what the book is about is, why does this happen? Why is the immune system so activated, causing heart disease or strokes or the other things that you're about to hear about? Why? Where does it come from? So if we look at people who are at risk for the development of autoimmune disease, here's the things that we see. The National Institute of Health tells us that the purpose of biomarkers to look for this, to identify it early, comes from, there's 6 components. Why do we use biomarkers? This is why you use tests, the blood tests, to identify, are they on the autoimmune spectrum? Is this happening to them? Autoimmunity plays a major role. We know that in development of dyslipidemia and plaque formation. So what does that tell us? The second sentence in that research article said the mechanisms underlying these changes include the interplay of inflammation and antibody formation. So what do we have here? Here we have predicting specific organ involvement. Here we have enabling diagnosis before the onset of symptoms. We have predicting and monitoring response to therapy. These are all the mechanisms that National Institute talks about as to what to do for autoimmune disease. What do you need in biomarkers? Here's the study that will help you put together how to use these biomarkers. This is from Melissa Arbuckle, and she went to the VA and she looked for people with the autoimmune disease lupus. She found 132 people at this VA center with lupus. Now, if they're in the VA system, they're veterans. If they're veterans, they were in the armed forces. If they were in the armed forces, they had their blood drawn many times when they were in the armed forces, many times over the years. So this is when they were healthy in the Navy or healthy in the Air Force. What most people don't know is that the government's been saving and freezing all of that blood since 1978. They've got tens of millions of samples of our service people's blood. So Dr. Arbuckle went back to the VA and asked for permission to look at the blood of the people currently diagnosed with the autoimmune disease lupus from when they were healthy in the Air Force or in the Marines. And she received permission, and what did she find? Here was part of her summary. These antibodies to the autoimmune disease lupus are there years before there's a diagnosis, and the appearance of these antibodies tend to follow a predictable course with an accumulation of more antibodies before they get the diagnosis. What does that look like? Well, here's one drawing that she did in her research article, and you can see the antibodies were elevated. They were at least 50% above normal 6 years before they ever had a symptom. 6 years. And then you can see where the clinical symptoms began, and it took 6 months to 2 years to get the diagnosis. In this graph, she has it at about 6 months, but you'll see in a minute, it can take 2 to 3 years to get the diagnosis of lupus. You go doctor to doctor to doctor for someone trying to figure out what's wrong with you. This graph from her study shows that there are 7 antibodies to lupus, and all 7 of them were elevated years and years beforehand. At the bottom of the top graph, but at the bottom of the top graph, you see 10% elevation. 0 is normal here, 10% elevation. The next one's at about 22, 23%. The next one's at about 39 to 40. And you see they all keep climbing every single year. They keep going up, going up, going up until they hit a plateau and you get the symptoms, and then eventually you get the diagnosis. Now, why would we ever have antibodies to our own tissue? Let's say to lupus or to your thyroid. I'll use the thyroid as an example. More people understand about antibodies to thyroid. Why would we have antibodies to our thyroid? It's because, Mrs. Patient, your body, you have an entire new body every 7 years. Some cells turn over very quickly, like the inside of your guts, every 3 to 7 days. Some cells are very slow. The bone cells and brain cells are slower, but you build new cells for every tissue of your body. Well, how do you do that? Well, your immune system has to have antibodies to get rid of the old cells, the worn out cells, the damaged cells. So there's room. It makes room for the new cells. So that's why when you do a blood test, there's a normal reference range for thyroid antibodies. There's a normal reference range for lupus antibodies. There's a normal reference range for brain antibodies. It's normal. But when you have elevated antibodies, you're killing off more cells than you're making. That's a deficit. And as you continue to have elevated antibodies, killing off more cells than you're making, killing off more cells than you're making, killing off more cells than you're making, eventually you've killed off so many cells, now that tissue, whether it's the thyroid or your liver or your muscles or your skin, that tissue can't function the way it's supposed to anymore. Now you start getting symptoms. They're kind of unusual symptoms, maybe a little diffuse. You can't quite pinpoint it. You go to 2 or 3 doctors, and then eventually you get a diagnosis of lupus. or diabetes or Alzheimer's, as if you got the disease yesterday. Nobody gets Alzheimer's in their 60s or 70s. People get Alzheimer's in their 20s and 30s. It just takes decades of killing off brain cells, before you've killed off enough brain cells that your brain can't work very well anymore, or your thyroid can't work very well anymore. You'll see the numbers on this in just a minute. So this is the mechanism of development of autoimmune diseases. And my computer has frozen again. Oh, there we go. Okay. And that's emphasizing the years. And what Dr. Arbuckle said, first you have normal immunity. Normal immunity means you've got antibodies to your thyroid, but it's in the normal range. You're getting rid of the old cells to make room for new cells. Then you have benign autoimmunity. You have elevated cells, but you don't have any symptoms. Elevated antibodies, but you don't have any symptoms. Then you get pathogenic autoimmunity, where you have elevated antibodies. Now you're getting symptoms. Now there's a pathology. And then eventually you get the illness. You get diagnosed with the illness. Well, when did the problem begin? It began back when you got the elevated antibodies. The problem did not begin when you were diagnosed with thyroid disease, or you're diagnosed with brain dysfunction or cognitive decline. The problem began with the elevated antibodies killing off your tissue. That's called the prodromal period. Dr. Arbuckle referred to that as the prodromal. It's a good Scrabble word. It means before symptoms. And you're killing off the antibodies, the elevated antibodies are killing off brain cells, killing off cells before you have symptoms. So let me back up so that you don't get confused by that slide. So immunologists all over the world looked at Dr. Arbuckle's article in 2003 and said, that's brilliant. It's brilliant. Let's go back to the blood banks and look for people with diabetes and look for people with rheumatoid and see if this is true. And this is what they found. It's true across the board. So that we have so many studies now, you can develop what's called the PPV, the positive predictive value. So the first one there is lupus. SLE is systemic lupus erythematosus. If you have any of the antibodies elevated to lupus, the positive predictive value, you're getting lupus, is 94 to 100% within 7 to 10 years. 94 to 100%. Scleroderma, it's 100%. If you have either of those antibodies elevated, you're getting scleroderma in 11 years, within 11 years. Rheumatoid, you can see the PPV there for 14 years. Sjogren's, primary antiphospholipid syndrome, and that bottom one there in those three, this is beta-2 glycoprotein 1. This is really important for women with unexplained miscarriages. This is a really common cause of unexplained miscarriages. Hashimoto's thyroid disease, especially postpartum, 92% PPV. You're getting Hashimoto's within 7 to 10 years. Primary biliary cirrhosis, type 1 diabetes, Addison's, that's of the adrenal glands. Look at Crohn's. If you have these antibodies to yeast in your bloodstream, Saccharomyces cerevisiae, which is a common yeast, a normal yeast in the microbiome, but if you have elevated antibodies to them, it's 100%. You're getting Crohn's within 3 years. I mean, these numbers are shocking. When would you want to know if you have a weak link in your chain and your tissue's being killed off? I propose most of us want to know right away, as soon as possible, so that you've got this window of opportunity to do something about it. And this is one of the tests that came out. This launched in 2011. This one blood test looks at 24 different tissues. The top 4 gray ones are to your gut, 2 to your thyroid, your adrenals, 4 to your heart, your reproductive system, your muscles and your bones, your liver, your pancreas, and the bottom 6 are to your brain. I did this test. I had 3 elevated to my brain, and I thought, this is a mistake. No, it wasn't. So this test is available to begin identifying where are you on this spectrum. And this is so important to identify. It's just critically important, because when you identify this stuff ahead of time, well, Mrs. Patient, you have a 94% likelihood, if things continue the way they are with these elevated antibodies, you're going to have thyroid autoimmune disease within 7 years. And thyroid autoimmune disease means it's hard to lose weight. You can't shed 3 pounds even if you don't eat for 2 days. Cold hands and feet. You wear socks to bed. Feel emotional, depressed. Thyroid symptoms can affect any tissue of your body. So that's what the book is about, this whole concept of what is autoimmunity and where does it come from and what do I do about it. So what's the trigger in the production of the antibodies to your immune system? Once again, it's these macromolecules, these big molecules that get through the tears in the cheesecloth, that they get into your bloodstream, and your immune system has to make antibodies to these molecules to protect you. And we know now that it's the loss of the intestinal barrier function. It's the tears in the cheesecloth that set you up. Mrs. Patient, if you pull at a chain, the chain breaks at the weakest link. It's at one end, the middle, the other end, your heart, your brain, your liver, your kidneys, wherever your genetic weak link is, that's where the chain's going to break. And what pulls on the chain? It's the inflammation that's caused by the immune system fighting these molecules that get in through the tears in the cheesecloth as a primary culprit pulling on the chain. So if your genetics are for thyroid problems and you've got tears in the cheesecloth, intestinal permeability, the leaky gut, you're going to develop thyroid autoimmune disease, or brain or heart or lungs or liver. It doesn't matter what tissue of the body it is. If that's your genetic weak link and you have tears in the cheesecloth, you have intestinal permeability, that's where the link's going to break. And now you've seen the PPVs for different tissues of your body. And there are many, many more studies on this now. The field is called predictive autoimmunity. And some of you have seen this video before where the large molecules in your intestines, they can't get through the walls of the bloodstream to go down, the walls of the intestines to get through down into the bloodstream. Only the small molecules can get through. And for our nutritionists, notice that those small molecules go right through the cell and between the cells. Parasitosis and transcytosis. Really important because high-fat diets, fats are absorbed transcytosis right through the cell. You have high-fat diets, you break up your cells, you cause intestinal permeability much more easily than if you have a more normal amount of fat diet. So there's some dangers to high-fat diets. So that's the healthy gut. But when you look at the gut that's got tears in the cheesecloth, and that's the design here with the spaces in between the cells, now when you eat food, these big molecules get right through. Wait, not that molecule. Oh, that's beef. Oh, no, I'm going to be allergic to beef now. Oh, that's chicken. Oh, no, I'm going to be allergic to chicken now. Not banana. Are you kidding? Bananas? I love bananas. Oh, but your immune system's going to make antibodies to bananas now because these big molecules get into the bloodstream and they're not supposed to be there. They're called macromolecules. These are the patients where you do a 90 food panel looking for what are they sensitive to. And they come back sensitive to 25 or 30 different foods. And the patient says, oh my God, that's everything I eat. Well, of course it is, because your immune system's trying to protect you. You don't try to shut down the immune system. Rather, you heal the gut, wait 6 months and test again. And then there'll only be 2 foods, maybe 3 that are true culprits here. It's just your immune system trying to protect you. So there's a common initial pathway, and this is the therapeutic target to almost every degenerative disease. And that's what the book is about, the Autoimmune Fix, and it's laid out, if I say so, beautifully in this book. I mean, the feedback has been so good. I mean, I'm honored that it's a national bestseller, National Book Award, and Amazon top seller in 4 categories. It's because, and it's not, I'm not saying this because I wrote it, but because I'm very proud that it really helps people understand this big picture and then what to do for you and your family to protect them. So a common initial autoimmune pathway and the therapeutic target to degenerative disease. If you get this pathway, you understand what's going on here. The immune response is to intestinal antigens, these macromolecules that get through the tears in the cheesecloth. That causes intestinal inflammation from those macromolecules getting in the bloodstream. That causes tight junction barrier proteins, antibody production to the barrier proteins. You get this leaky gut, which is pathogenic intestinal permeability. You get these antigens and macromolecules getting through into the bloodstream. Your immune response to those antibodies, you produce antibodies to those foods or environmental triggers. Then by molecular mimicry, which I'll talk about next, you develop antibodies to your own tissue, and the result is now you've got an autoimmune mechanism going on. So when you think of these antibodies, think of an antibody to wheat going through the bloodstream. Now, the most common antibody to wheat looks for, let me back up. Mrs. Patient, proteins are like a pearl necklace, and hydrochloric acid made in your stomach undoes the clasp of the pearl necklace. Now you're holding a string of pearls. The enzymes, the digestive enzymes produced by your gallbladder, by your pancreas, by the microbiota in your intestines, these enzymes act like scissors to cut the pearl necklace into smaller clumps of the pearl necklace, and smaller and smaller and smaller and smaller, until they're down to each little clump of each little pearl of the pearl necklace. That's called an amino acid. And those go right through the cheesecloth. The bigger clumps, called peptides, they can't get through. They're not supposed to get through. But when you get tears in the cheesecloth and these peptides get through, now your immune system has to make antibodies to these big molecules, these macromolecules. So the most common macromolecule to poorly digested wheat, for example, is 33 amino acids long. That's a clump of the pearl necklace. So your immune system makes antibodies to this 33 amino acid long clump. I'm going to say AABCD. I'm not going to say 33 letters, just AABCD. So now you've got these antibodies going through the bloodstream looking for AABCD everywhere they go. Now let's take a look. We're going past the thyroid. The blood's going past the thyroid. We're in the bloodstream and we're coming past the thyroid now. The tissue of the thyroid facing the bloodstream is made up of proteins and fats. Proteins are made up of hundreds of amino acids long, makes up the surface of the inside of the blood vessels of the thyroid facing the bloodstream. Part of the hundreds of amino acids long sequence that makes up the inside lining of the thyroid is AABCD. So now you've got these antibodies going in the bloodstream. They're looking for AABCD anywhere they can find it. AABCD, AABCD, AABCD. Now they look over there, hiding out in the surface of the thyroid, AABCD. And these antibodies to foods attack your thyroid. Now you've got a damaged thyroid cell. Now your immune system, which makes normal levels of thyroid antibodies, has to make more. So it makes more. You make antibodies to AABCD. You have a sandwich. CD. Now they attack your thyroid. Croutons on your salad. Antibodies to AABCD. Thyroid, if that's the weak link in your chain. Molecular mimicry. Excuse me. The antibodies to the foods now start attacking your own tissue because the tissue looks similar enough in the amino acid structure. Primary mechanism for why you see gluten sensitivity in the medical literature with brain disease, dairy sensitivity with pancreatic disease, egg sensitivity with eye diseases, spinach and soy with eye diseases, because the molecular mimicry of the food signature pattern looks like the inside of the blood vessels of that tissue, or looks like that tissue. So the body, the antibodies produced to attack the food now attacks that tissue. That's molecular mimicry. Now remember, this is why the autoimmune process can be arrested. If you stop the interplay between genes and environment, and what's the environment thing? These big molecules that are getting into the bloodstream, that's the environment getting in there that's offensive. When you reestablish the intestinal barrier, when you deal with the tears in the cheesecloth. So can foods trigger intestinal permeability? This is such a great study. I think every nutritionist needs to see this study. And for those of you that are not nutritionists, I think you'll appreciate this. So at Harvard, they took patients with irritable bowel syndrome. To qualify for the study, they had to be failures to all treatments for at least a year. These people were suffering for at least a year and nothing was working. So they did this, it's called confocal endomicroscopy. They put a tube down their throats into their intestines and they watched what the cells looked like when they were exposed to different foods. So here's what the cells look like. On the left, that's confocal endomicroscopy. These are cells inside the live and human intestine. On the right's electron microscopy. So this is normal. And what they did was they exposed patients to either cow's milk, wheat, yeast, or soy, or just sterile water. They injected a white dye into the veins in the leg. So the white dye was going back up towards the heart. And when it did that, it went past the blood vessels of the intestines. So there's this dye in the intestines. And what's supposed to happen, the picture on the left is normal. These are the cells that are kissing up against each other. The one in the middle labeled B, you can see the white dye is like coming out outside of the cells. So it's coming out into the tube of the intestines. And then the one on the far right is the white dye is all out in the intestines. That's the leaky gut. That's the tears in the cheesecloth from the reverse direction, but that's the tears in the cheesecloth. And what did they find? Now, this is a video. Oh, let me back up there. Can I back up? Yes, I can back up. There it is. Watch this video. This is 5 minutes in the intestines when exposed to some of these foods. They took pictures and spliced them together over 5 minutes. Watch what happens here. You can see there's the white is coming out a little more here. Here's the leakage coming in between the cells, more whites over here, more leakage now. They're bursting and coming out into the lumen of the intestines. Lots more. This is intestinal permeability. This is leaky gut in reverse, but this is leaky gut where this stuff's leaking out into the intestines. And they produce this within 5 minutes of being exposed to the food that they were sensitive to. That within 5 minutes, this occurs. And that's why these patients were all failures to the drugs that they were using, because the people were eating the food. They didn't get sick when they were eating the food, so they didn't know that it was a problem. But that's what was happening for them. When they took the food out of their diets, they started to get better. So in the book, we talk about testing, and I showed you the 24 tissue panel that looks for autoimmunity. Another panel that's critically important is a check for wheat sensitivity. And this is a test that just came out in January of last year from Mayo Clinic. And I highlighted, as you can see, where they say it's a new era in laboratory testing. Because with these tests, with this new way of testing, it's called silicone chip technology, you have a 99% specificity, meaning if the problem's there, a 99% sensitivity, meaning if you've got the problem, it's going to show up, and a 98% to 100% specificity, meaning if it shows up, this is your problem. So if you come in knowing that you've got this problem, it's going to show it. That's sensitivity. Or if you come in and if you don't know you've got the problem, but the test comes back positive, you've got the problem that many times. So it's the most sensitive testing that's ever been done. There is no statistics like this for ELISA or any other type of laboratory testing. This is a new era in laboratory testing. And what they're doing is called microchip technology. And they can look at 66,000 different peptides of poorly digested wheat. you know, when the scissors are cutting the pearl necklace. There are so many different pieces of that pearl necklace that can cause a problem for you. And almost every laboratory in the country checks one and only one. The 33 amino acid peptide is a very important one to check, but it's not the only one. That's why this test is so much more sensitive. And this silicone chip technology, they can put thousands, actually, of antigens on one blood draw. They can test one blood draw and look at so many different things. So this is what the test result looks like. And this is one test, one blood draw that looks for celiac disease. It looks for intestinal permeability. It looks for the markers of early celiac disease, referred to as fusion peptides. It looks for markers of problems from wheat that affect your skin, causing an autoimmune disease called dermatitis herpetiformis, or your brain, transglutaminase 6, which is a primary component in brain tissue. It looks for wheat germ. It looks for gliadins. It looks for allergies, so it includes IgE. It looks for glutenins. I mean, it's just a remarkable test in terms of all the different markers. And it also looks at these non-gluten pieces of the pearl necklace that might be the only trigger you have. So if you're only checking gluten, you can miss it in some people. So this test is out now and available. And these are all the markers on that test. It's just a marvelous test that everyone should download these, take this information to the doctor that you work with, have this test ordered for the patient, because it's the most sensitive test that's out there today. And I'm giving all of you a gift. I'm giving you all of the studies that I'm talking about here today. There's 43 studies, and 34 of these studies are the entire study. They're free. If they were not free, I can't give it to you free. That would be illegal of me, but I'm giving you the links to the abstracts so that you can read the abstracts of the ones that are not free. But 34 of the studies are free, so you can read more about this. Just go to my website, thedr.com/NANP, and the studies are there for you so that you can read more and learn more about this. So let's see, my computer has just frozen again. It would be nice if it can come back. There we go. Thank you so much. So we are at 42 minutes here, and I was told I could go to 45 minutes. And this next section.
Go ahead. Yeah, keep going. It's great. This is really good.
Okay, then I'm going to keep going. From a nutritional perspective, how do you arrest this tear in the cheesecloth? How do you arrest this? The first thing you do is stop throwing gasoline on the fire. So you have to find out, in terms of the environmental triggers, if foods are a problem, what foods are they? That's why I showed you that test. That's a primary test I believe everyone should do. I think, and it's available on my website. For those of you that don't have a doctor to work with, you can order it on my website and get it done. And if you're one of my CGPs, you can order it for your patients on my website. So, but the first thing is stop throwing gasoline on the fire. Second, what's the nutrition to use that will help? Now, I have to tell you, though, if you don't address the diet and what's on the end of the fork, the nutrition can't work very well. It just makes sense, right? You don't want to keep throwing gasoline on the fire. But in terms of putting the fire out, what do? The first thing is a pleiotropic approach. What's a pleiotropic approach? All roads lead to Rome. There are many ways to turn the genes on to heal the gut. Many different ways. So I'm going to tell you about 8 different ways right now, but there are many ways. No one way has a corner in the market. If there's anything that has a corner in the market, and it's one of the things I'll talk about in more detail, it's colostrum, because that's the first 3 days of mother's breast milk. Why is the first 3 days of mother's breast milk not breast milk? It's colostrum, because the messages from colostrum turn the genes on to heal the gut. Because every newborn baby has huge tears in the cheesecloth. They're not torn. The cheesecloth hasn't sewn up yet because baby's been inside mom's uterus. But now baby's out in the world. All right, baby, let's tighten up those tight junctions It's time to like get some barriers there because you're about to start eating food in a few months. Let's get this cleaned up. And that's a primary job of colostrum. But outside of colostrum, there are many things that can be of benefit. For example, here you see how curcumin hits all these different factors, these different genetic pathways to reduce inflammation in the body. So all roads lead to Rome, and we want a pleiotropic approach to addressing pathogenic intestinal permeability. Of course, the first thing is avoid the inflammatory triggers. And some people think that if you don't have celiac disease, you don't have to worry about it. And some doctors are still saying stuff like that, and that's just utter nonsense. And, I don't have time anymore just to say, well, it's okay. No, it's not okay. Read the science. It's really clear. Non-celiac gluten sensitivity and non-gluten protein sensitivities from wheat are real, and they cause lots of symptoms for people. They cause molecular mimicry and autoimmune diseases. So just don't put up with this anymore. If a doctor says if you don't have celiac, you don't have a problem with wheat, keep the doctor for what they're good for, but find a new doctor to deal with this also. So here's a study from Harvard where they looked at celiac patients recently diagnosed, so they had lots of problems in their gut. Celiac patients in full remission, that means at least a year in a gluten-free diet, and their gut had healed. Non-celiac patients with gluten sensitivity, and people that had no problem with wheat. They looked at all four groups, and what's their conclusion? Tears in the cheesecloth after eating wheat exposure occurs in everyone. And at one point in the article, they said in all humans. So anyone who's listening here today, if you're a human, this relates to you, whether you like it or not. It doesn't matter if you don't feel bad when you eat wheat. Unfortunately, only 1 person out of 8 has GI symptoms when they eat wheat. For 7 out of 8, it affects the brain or the heart or the lungs or the liver or the kidneys or the joints. And you don't feel it when you're increasing antibodies to your brain or to your kidneys or to your lungs. You don't feel it. So it doesn't matter how you feel when you eat wheat. So for those of you that do not want to go gluten-free yourselves, that's fine. You have every right in the world to live your life the way you want and for you and your family, but don't you dare ever tell people this thing about wheat sensitivity. It's a little bit of hodgepodge. Read the science. I'm giving you the studies. Read the studies. And then if you say that again to a patient, shame on you. Excuse me, but we don't have time to mess around anymore. You may not like this about wheat sensitivity because it's the #1 food that we all eat, and that's okay. It's your choice. It's your choice what you choose to implement. But if you're representing yourself as a healthcare professional, read the science and then talk from the science, not somebody's opinion in an article. Read the science, like this one from Harvard, and there are many studies like this. So this book is all about what I'm telling you here in much, much more detail. One of the things I do in the book for people that can't afford testing or they can't get testing is I recommend a 3-week protocol. And in that 3-week protocol, I recommend that they avoid 3 foods, wheat, dairy, and sugar for 3 weeks. And we give them recipes for all 3 weeks for breakfast and lunch and dinners that your kids are going to eat. Try this and see what happens. And watch when the teacher sends a note home that says, that new medication for your child's doing very well. They're doing great in school. And you call the teacher and say, I'm not doing any medication. I just took them off of wheat, dairy, and sugar. And then the teacher will say, oh, I've heard that before. I've heard something about that. So we recommend the 3-week protocol. Next, after avoiding the inflammatory triggers, vegetables for their soluble fiber because they help to increase short-chain fatty acids. The most common one that most people know about is butyrate, also called butyric acid. And the fastest growing cells in the body, the inside lining of your gut, every 3 to 7 days, you have a whole new lining to gut. The fuel to make those new cells, the raw material is butyric acid. And the butyric acid, if you don't have enough butyric acid, you're going to make new cells every 3 to 7 days. And if you don't have enough of the raw material, you're going to make your house out of straw instead of brick. That's why if you go into Google and you just type in butyric acid and colon cancer, here come the studies that you build weak cells when you don't have enough butyric acid, much more vulnerable to colon cancer. That's why you need lots of vegetables, because vegetables are the raw material, that the vegetable fiber is the raw material that the good bacteria in your gut uses and converts into butyrate, which then is the raw material you make your new cells from. So you build your house out of brick instead of out of straw. And Dr. Terry Wall's protocol, she was reversing MS for herself, of course, first, and then in patients. It's 12 cups of vegetables a day before they ever think about a carbohydrate other than vegetables. 12 cups a day. There's not much room for pasta when you've eaten 12 cups of vegetables a day. You try this for 2 days, the nutritionists who are listening here. Eat 12 cups of vegetables a day for 2 days. Measure it out and see how much pasta or bread you eat. And then notice how you feel. And you see, my gosh, I feel different. I feel so good. So these are studies that just talk about prebiotics and how important prebiotics are. I'm not going to go through why. You all know about that. Bone broth. Dr. Walls recommends a quart of bone broth a day to her veterans who are completely disabled. They can't work. They can't function. They've got PTSD or they've got severe pain from losing a limb. She gives them 12 cups of vegetables a day and a quart of bone broth every day. They get better. She's getting such great results that the VA hospital, where she works, the system sent out a team to investigate what are they doing out there in Iowa to get these results. And they were so blown away, they gave her $1.5 million to document what she's doing, to teach doctors in every VA hospital around the country about this protocol and why it works so well. And these are just some studies on why bone broth is so good for you. And it's because it forms a seal. You see the seal here. The gelatin tannate is in bone broth, and it allows your intestines to heal and seals up the tears in the cheesecloth. And then what happens is you heal that lining and the permeability is gone. That's a role that bone broth plays in healing intestinal permeability. Next, fermented vegetables. And I tell patients, go to the Whole Foods or another natural store, get 5 different types of fermented vegetables, non-pasteurized. Get kimchi, sauerkraut, pickled beets, not pickled, fermented beets, curry flavored, Italian flavored fermented vegetables. Walk by the refrigerator, have one every day, one forkful every day. It's the variety that makes the difference to repopulate your gut, to re-inoculate your gut with many different strains of beneficial bacteria. And these are just studies that talk about why that's so good for you. Nutrients to address inflammation, to rebuild the microbiome, and to heal the intestinal lining. So what are those nutrients? Well, the first one's vitamin D, and I'm going to go past these studies. This is just the technical stuff of why vitamin D works so well. And I'm going to show you a study here, a slide here, that puts it in perspective. Let me see if it comes up next. Here it is. This is the slide. In the upper left is the drawing. In the upper right's a picture of a tight junction between 2 cells. Then you see the circle where they blew it up and you can see it's looped. This is the Panama Canal. That the top one opens up, the kissing joint. You see it's drawn out next to the picture. The kissing joint there is the gates of the Panama Canal. And then you see the big drawing to the right with the red circle around it. That's the artist's drawing of the kissing joints. And you see the pericellular space, that's where food comes down, and the tight junction, the kissing joints open and close. These are like shoelaces. And the gates open, the food goes in, the gates close, the immune system checks it out. The gates below there open, the food goes down a little bit lower. The gates close, the immune system checks it out. The next gates open, the food goes down a little bit lower. The gates close, the immune system checks it out. Aren't the pictures cool? It's so cool to see this. Now let me show you how many areas in this function to allow only small molecules to get in at a time, how much of this is controlled by vitamin D, and then just imagine what happens when you don't have enough vitamin D. Here we go. All of that. is modulated and controlled by vitamin D. Every one of those areas in the small intestine, the tight junctions, the adherence junctions, the kissing joints, the tight junction strands, the occludens and the zonulin claudins, they're all modulated by vitamin D. So you want to take vitamin D. And this one's capsules. So I recommend 5,000. Well, I actually recommend it by weight. And so for an adult, when they have permeability, I give them 5,000 a day. But in general, for vitamin D, these are the recommendations that I give to people. And you certainly can do your own. But you don't want to give a liquid. You don't want to give a sublingual when you're dealing with gut problems, because you want the vitamin D in the gut. So you want the capsules or the tablets to go down into the gut when you want to specifically heal intestinal permeability. The good flora. So you all know about the good bacteria and what they do and how they're supposed to work for you. These are just some studies that talk about how great the microbiota is for you and all the different things that they do. And you, as nutritionists, you know this. So I'm going to go past this. I talk about a couple types. This is one type that's really excellent for you. Saccharomyces boulardii is just excellent to heal the gut. Another type is VSL number 3. It's excellent to heal the gut, heal the tears in the cheesecloth. Some recommended dosages for those. Fish oils. Fish oils are anti-inflammatory. That's how they work. And they are very, very good in helping to heal the gut. They turn genes on the gut, in the gut, that vitamin D does not turn on. And so this is an example of all roads lead to Rome. There's no one thing that's going to get the job done for everyone. And up to 3 grams a day are great for you. I give much more than that sometimes, but you have to be careful because fish oils are also a blood thinner. So anyone that's sensitive to blood thinning, you want to monitor them very closely. Glutamine. Glutamine is the most commonly used amino acid in the body. It's great to heal the gut. Here's a study with 30 grams of glutamine a day for 4 weeks for people with colitis. Every single person improved dramatically, independent of how severe their colitis was, every single one. And when they stopped the glutamine, they relapsed and they got bad again. Why? Because they were still throwing gasoline on the fire. No one talked to them about how to heal the gut by the foods that they're eating and to stop throwing gasoline on the fire. So a little more about glutamine here, some recommended dosages. Turmeric. I can't imagine any time that you're dealing with an anti-inflammatory situation that you're not including turmeric. It turns on so many genes, so many different pathways to prevent amyloid plaque buildup, neuroprotection, enhances cognition. It's a diagnostic marker. It's an antioxidant. It's anti-inflammatory. It helps to seal the gut lining. These are the dosages in different studies using curcumin. Here's once again all the pathways that are turned on by this one product. It's marvelous and should be included in any anti-inflammatory protocol. And look at all the different diseases for which there are studies showing how beneficial curcumin is, and watch how many of them are autoimmune. Those are all autoimmune. Now, I'm going to back that up, and I'm going to do that. Wait a minute. Can I back that up? No, it's not going back. Can we go backwards there? Yeah, there we can. Can we go backwards? I want to do that again because I just love. It took me an hour to make this slide, so I like doing it. You see the slow one there that's kind of moving the little thyroid. It's moving a little slow. That's a joke there, folks, in the midst of all this. But look at all the autoimmune diseases that are beneficially impacted by using curcumin. Colostrum.
And we are out of time, Dr. O'Brien. It's noon.
Okay. I have 4 more slides, but okay. I will just say thank you very much, everyone, for attending. And the book, The Autoimmune Fix, addresses all of this.
Yes. And I don't know if you've got your slide available, but there are some questions that I think can probably be found either on the doctor.com website or in your book. Lots of questions about the testing, where to start. lots of people thanking you for this and wanting to know if they can share this video with clients.
Yes, of course you can.
Great, great.
Well,
and
actually, I think
your website.
It's up to you guys if it's available or not, but I'm fine with it.
Yeah, is this on your website? Can this be found on your website, thedoctor.com?
The presentation is not on the website. The studies are on the website.
Perfect. Great. Okay. Wonderful. Well, Dr. O'Brien, it is always fascinating to have you with us. Thank you for joining us today with this presentation. I'm so sorry we had to cut it short, but we appreciate you being here and giving us this wealth of information that you share with us. Thank you so much.
Thank you very much for the opportunity, and Godspeed to all of you in your health journeys.
Thank you. Thank you. All right, and everybody, I just want to thank you for joining us today and remind you that next month for the Scoop, Thursday, July 13th, we'll have Dr. Sally Schultz, who is an orthomolecular mitochondrial specialist, and she's going to be discussing epigenetics and nutrigenetics in July. I hope you'll mark your calendars again, July 13th, and thank you for joining us and have a wonderful rest of your day.